Welcome to our show, Health and Wellness, Myths versus Facts. I'm Ambika Singh Kama. As of now, we know that Omicron is a less severe variant of the COVID-19 virus. In spite of that, people are getting hospitalized, though their numbers are less compared to the second wave of COVID-19. It is visible that vulnerable people, like those with comorbidities like diabetes and heart disease, elderly people, people who have not taken both their vaccine doses, can have a severe form of COVID-19 following infection from Omicron. People with diabetes should take extra care as they suffer from various other comorbid conditions as well. Diabetes and heart disease both are leading causes of death in India. Earlier, one used to see only the elderly suffer from these conditions, but of late, younger populations are also getting affected by these conditions. Both these chronic illnesses have substantial complications. It is easier to manage the disease if you're aware of the warning signals and problems associated with these conditions. Expert advice by our panelists will help our viewers garner correct information and act responsibly. So if you have any questions you would like to ask them, please send them to us via WhatsApp to the number. The number is +91 9167 666 941. Yes, that's the number for you to send us your questions for our experts. Please do also send us your name and your location. So let me introduce the guests we have with us. We have with us Dr. Prabhat Agrawal, MD, FRCP Professor, Department of Medicine, SN Medical College, Agra. And we have with us Dr. Sambasiva Rao Chevuru, MD, DM, Consultant Interventional Cardiologist, Sunshine Hospital, Secunderabad. Thank you all so much, doctors, for joining us today on this interesting conversation. Starting with you first, Dr. Agrawal, children and teens are still unvaccinated. What impact can Omicron have on these people? And can we see the new onset of diabetes or hypertension in young adults after this third wave?
Yeah, good afternoon. As far as concern of the question regarding first part of the question about the kids or the children.
Yes.
As far as we know the kids have very good immunity compared to the older one. So teens one and the children till now I have seen we have experience of the last two waves. Right now we are in third wave. Many kids have very disease like simple flu. One day they have simple fever or cough or cold. Otherwise they are doing very well. So till now we have no very bad experiences with the kids. So vaccination part is that they are still, we know they are unvaccinated. What in the rest of the world, we also seen that there are so many population in the world which are unvaccinated till now. So the effect of Omicron is almost same, both are vaccinated or unvaccinated. We can't say that this vaccination is really helpful in this Omicron.
Yes.
Second part of question is regarding the new onset diabetes or the hypertension, especially in the children. So we have experiences in the last wave where we find that there are few cases reported in which 2 or 3 kids develops diabetes, especially just after this COVID. But with that time, most of the kids becomes normal, their sugar becomes normal. So it is very early to say that future of these kids or the kids which developed this infection, especially in this Omicron in this wave. Okay. So it is very early to say whether they will develop hypertension or the diabetes, but I think this Omicron will be definitely a milder disease, so we will have good future in our India, especially.
Okay, thank you. Good to hear that it is not affecting kids so severely, and as of now, of course, as you said, studies are still going on, and hopefully it should not be affecting the kids. Dr. Rao, it is found that Omicron causes less severe disease than other coronavirus variants. Will it be able to produce antibodies that will make us immune against other COVID-19 variants? And can Omicron's immunity and the COVID-19 pandemic, can it really end it? Sorry, do you think Omicron is really the end of the pandemic?
To comment on this question, that means you are asking me that Omicron gives the sufficient immunity to the people that we can enter the antibody, can end the pandemic. Means Omicron is a very latest variant. So as that way, COVID is giving many surprises every day, giving the new information, and we have to search for many things. Till now, the Omicron, what the data we have is recently the ICMR is been released on data that is Omicron giving a sufficient antibodies that which can neutralize even the Delta variant and other variants of the Omicron till now. So in the same time, the one more thing has been came from Imperial College of London that shows that giving that 86% of the protection giving through the Omicron infection for the future reinfections and the future infections with other variants. So this is all giving some hope that this Omicron is doing some good thing, because it can be helpful for the herd immunity and to prevent this decreasing the pandemic. But one thing, what the experiences from the last 2 years is, even the vaccination is giving the antibodies, which will last for only 4 to 6 months.
Okay.
So till we don't know, these Omicron antibodies will last to only 6 months, or it is giving the permanent memory to the immunity, which will fight for the future variants of the COVID. Right now, we cannot comment on that.
Okay.
But the main good thing is it is causing any less severe disease, and it is not causing much hospitalizations. One thing. At the same time, it is spreading very faster than pace of the vaccination. Right, so it is covering more world with the infection and giving the antibodies to the more people in the world.
Okay.
So it can prevent the spreading of the other and emerging of the other COVID variants. Also, it can be helpful.
Okay.
So it giving, because of these things, we can hope that it can be the end for the pandemic, or at least it can decrease the pandemic severity to the endemic levels. It can be the hope, but till now, we cannot confirm it now.
Absolutely. I think it's all about being hopeful, and let's keep our fingers crossed that, this is really the end. Dr. Agrawal, the next question we have from our viewer, it's a WhatsApp question by Mr. K. Bansal. I am 66 and I have received both shots of Covishield. I got infected with Omicron on the 4th of January and had fever for 3 days. However, even now, while getting up in the morning, I sweat profusely. I continue to suffer from a cough and cold and have a scratchy throat. What could be the reason? So this question is a viewer question. Dr. Agrawal.
Yeah. As Mr. Bansal has stated that he has got all 2 vaccinations of the COVID, and he developed this Omicron. If he mentioned Omicron, I don't know whether he had done under the genome sequencing or not. If I consider it a simple COVID infection, then he might be having this Omicron or this variant, which are facing in this third wave, is almost very mild disease, as we know. And he suffered with this infection almost 20 or 25 days back from since today. So I think this COVID is over. But if it is a Delta, if it is not Omicron, then this type of person, especially older one, can develop some types of the myocarditis or some arrhythmias. So if he is diabetic, then he should look for the hypoglycemia if he is saying sweating in the morning issues. If he is not diabetic, then definitely he should undergo for the cardiologist checkup for especially the echocardiography and the ECG to rule out myocarditis. Second part of his question is he develops cough and cold, scratchy throat. So I think this is nothing to do with the Omicron or the COVID, as already 2 or 3 more than 3 weeks are over since last infection. So definitely he may develop another viral infection in the form of the URTI or something flu-like infection. So for that, he need a consultation from a physician. Okay. And for this sweating, he should go for a cardiac checkup by a cardiologist. Okay. Or at least for the echocardiography as well as the ECGs.
Okay, so you would suggest that Mr. Bansal does go for further checkups just to rule out anything and so that it avoids any complications. Moving ahead, Dr. Rao, is it true that people who smoke develop the cardiovascular diseases earlier than those who don't, and may even die, before they have it?
Yeah, it is 100% true. There is no controversy in that, because smoking is more dangerous to the heart. Because smoking will affect many organs, that's the lungs and other things in the brain. But coming to smoking to the heart, it doesn't not only giving the long-term effects, it's also cause immediate effects. If you smoke one cigarette now, it immediately shoot up your blood pressure and also your heart rate immediately. So, and again, if it is consumed continuously, it will have the long-term ill effects also will be there. Okay. And again, the smoking will have so many chemicals which will impact on your body. One thing is it will cause the vasoconstriction will be there. So vasoconstriction will cause shoot up of your blood pressure, and also it will decrease the blood flow to the heart, which is already having the blocks in that. So it will gives up it will trigger the heart attacks in that.
Okay.
At the same time, the smoking, that is a tobacco, will cause the property of the blood clotting, that is coagulant property is there. It will cause the clotting of the blood anywhere inside our body. If it occurs, if it clots the blood in the brain, it will cause the stroke, and if it causes the blood clots in the heart vessels, it will cause the heart attack. So that blood clotting property can be occurred even with your 100 cigarette or 1000 cigarette. If you go for the checkup today and everything is normal, the smoking, the cigarette that we will have in the night or the tomorrow's, that will cause the complete massive attack.
Okay.
So that means the smoking is more dangerous, which may cause ill effects it immediately when you consume it, or no need to have the consume of 10 cigarettes or 1000 cigarettes.
Okay,
so it is very much dangerous to have the smoking and the consuming of tobacco in any form, that is even you're taking in a gutka, the chewing form or inhalation form. Consuming of tobacco in any form is very much dangerous to the heart.
Yeah.
Meanwhile, we are seeing the heart attacks in the young population, that is in less than 40 years nowadays, very common. Among them, as a cardiologist, we are seeing among the young MIs, the most likely 80 to 90% of that is the smoking. Smoking is the main cause of the heart attacks in the young population now we are seeing in the day-to-day practices.
Absolutely. I think so, like you've explained it, it has long-term as well as immediate effects. So it's key that one gives up all bad habits and especially quit smoking. On that note, we're going to be taking a very short break. We'll be right back. Welcome back. You're watching Health and Wellness, Myths versus Facts. Dr. Agrawal, work from home has severely disrupted the routine of many people and altered their sleep duration as well. Are poor sleep quality and a later bedtime associated with a more pronounced postprandial glycemic response to breakfast the following morning? And what precautions should people with diabetes take to avoid fluctuations in blood glucose levels?
Yeah, as we go to the root cause of the diabetes, then most of the cases of diabetes is usually having because of the insulin resistance. Insulin resistance means insulin is there, but that is not working because of some resistance. So we have to break this resistance, and we have some certain things in our hand which we can reduce this resistance. One thing, exercise, aerobic exercises. Second thing is we can cut down our carbohydrates, we can cut down our calories. Third thing is the proper sleep. That is very important for any disease, especially in the diabetics. So if we are like we see in this IT person, especially in this lockdown or during COVID pandemic, we have witnessed so many young adults who came to us with the surge in the glycemic levels, very big surge, or some episodes of the hypoglycemia, some episodes of hyperglycemia, variations in the glucose just because of the sleep. And they said that our sleep is not very proper, so because of this, when we sleep, our sleep quality is not good, or we are not able to sleep in a very good shape. So such glycemic excursion there, this is only because of the insulin resistance. So by cutting down this glucose resistance, we can simply manage the glucose levels by doing simple exercises, by taking simple sleep, normal sleeps. And the second thing, what can be done for these fluctuations? So simple thing, always remember the variations in the glucose level is more dangerous than if somebody is having blood sugar, suppose having more than 200 for around a day or for a week. But if somebody is having sugar levels between one time he is having 50, one time he is having 200, one time he is having 300, one time 80. So these variations are very bad in compared to those person which have consistently elevated blood sugar levels.
Okay.
So we should avoid extremes of the carbohydrates. We should go exercise. We should reduce our dietary lifestyle. We should go something with the lifestyle modification, by which we can reduce this excursions in the glucose levels.
Sure. So variations is something one needs to be careful. I mean, the fluctuations, and that can be done, of course, like you rightly said, dietary. But sleep here is a very important point, I think, which we've spoken about, and that, Doctor, you've pointed out. Dr. Rao, are there any sort of symptoms or red flags that people should look out for, as a signal for young people who are at a risk of sudden cardiac death? And when should one consider going for screening?
Yeah. There is some guidelines are there when we have to go for the screening. According to the American College of Cardiology, every person up to the 40 years of age should undergo at least one cardiac comprehensive health checkup. So for that, in that they can assess the risk factors. So who they develop any diabetes or the hypertension or the any hypercholesterolemia or hyperlipidemia or the obesity. These are all the risk factors which will trigger the heart diseases in the near future. That should be screened at the age of the 40 years of age for every people, at least one. Based on those results, we can categorize them as a ACC risk score into mild, moderate, severe. So based on those, which category they will fall, on that way a doctor will decide how frequently he has to again go for the checking and what are the treatment and the lifestyle, or should they start the medication early as not or possible. Okay. This is for the normal people. But nowadays we are seeing even the young people are getting for the heart attacks or sudden cardiac deaths. So when we have to go early cardiac screening procedure means if they are having any comorbidities before the 40 years of age. Mm-hmm. Any comorbidities means what type of comorbidities means if we already having of diabetes or already having a hypertension or is already having a hyperlipidemia or the family history. What is the family history means? If they in a family that is mother, father, or any siblings, that is a first generation siblings are having of heart diseases in early age. Mm-hmm. That is, it is less than 55 years in male and less than 65 years in females is having of heart disease. Okay. Then they should undergo at least a sudden deaths, which we cannot be explained by any other means. The sudden deaths. That is also come under as the family history of the cardiac disease. Okay. If they is having of any of these risk factors under his history, they should undergo the early screening procedure before 40 years, that is 10 years before that. Okay. So after that, we can early diagnose any risk factors for him. Then we can treat it early. Mm-hmm. We can prevent the most of the cardiac deaths. Sure. At least we can postpone the development of heart diseases in those patients.
So I think early screening is important, and what you pointed out, if there is anything to do with genes, I mean genetics, and one goes a little earlier before 40, and else if you have any comorbidities, please get your screening done. Yes. Dr. Agrawal, the next question we have from a viewer, and I think a lot of people would want to know, the question is, I'm using sugar-free pills, are they good to use for diabetes patients?
This is a very common question asked by so many patients. Initially, we have the sugar-free pills was the saccharin, almost 20 to 30 years back. But now we have so many good sugar-free pills like aspartame. We have right now. We have sucralose. We have nowadays for the last 4 or 5 years. We have methi tulsi, which we call medical name is stevia. So these are the stevia is very good. It's almost natural thing. So while sucralose and aspartame is a little bit chemical. So if somebody is using stevia, then definitely it is okay. But 4 or 5 tablets are, if you are consuming a day, that is okay. But if you are consuming more than 50-60 tablets a day, or if you are just but always remember, few people think that if you are using sugar-free pills along with the high carbohydrates, then carbohydrate quality is not improved with the adding sugar-free pills. Just a replacement of sugar. What we can replace with these sugar-free pills, but it is not a replacement of the carbohydrate types. Suppose we can't replace it with the potatoes, we can't replace with the rice. So always remember, just a addition. But if you using 5 or 6 tablets a day, then it is okay, no problem then.
Yeah, it's the quantity. So it's safe to be used for diabetic patients, but I think an important point, which is that if you're using 4 to 5 pills and not 50, then it is safe. Thank you for clarifying that for our viewer. Dr. Rao, it is said that if people with diabetes with atrial fibrillation, which is AFib, are less likely to notice symptoms of the common heart rhythm disorder. What's the fact?
Yeah, if diabetes people will experience the less cardiac symptoms, not only in the AF, less cardiac symptoms, they will aware of that, because in these patients, what will happen means diabetes and long-standing diabetes will damage the peripheral nerves. So the pain sensitivity has been decreased a lot. So at the same time, the sympathetic and autonomic dysfunction will occur in the long-standing diabetes. These people will have the less awareness of these cardiac symptoms, not only in the AF and also the other partners. And coming to the atrial fibrillation is nothing but an irregular heartbeat, which will increase the heart rate from 100 to up to 180 or 200. So if the heart rate is increased very much, some people will develop the symptoms, a sudden drop of the BP, and sometimes it can be risk to the life also.
Okay.
But 20 to 30% of the atrial fibrillation patients will be in asymptomatic, which will diagnose incidentally when they come to the hospital with some other problem. But the problem, though they doesn't have the symptoms, the main thing problematic with atrial fibrillation is the morbidity and mortality caused due to the brain strokes because of this atrial fibrillation.
Okay.
In the atrial fibrillation, what will happen is because of irregular heartbeat, the blood clot will occur inside the heart. Because there is a irregularity, there is stasis of the blood in the heart, it will cause the blood clots, which will travel to the brain or some other parts of the body, and they will cause this brain strokes.
Okay.
This leads to the morbid life with the paralysis, or if they occur the major stroke, it will leads to the mortality also. That is the main problem with atrial fibrillation. So even though it doesn't have the symptoms, they should be treated with the anticoagulations especially, and there the rate control is much needed. So if the diabetic patients are not aware of these symptoms, diabetic patients should undergo the health checkups yearly at least. So the health checkup should include at least one ECG. The simple ECG can identify this atrial fibrillation. At the same time, nowadays we are getting the many gadgets are there.
Yes.
Coming, that is Apple Watch is very much popular in that. The Apple studies also has been conducted on this diagnosis of atrial fibrillation by these gadgets. That is the Apple Watch.
Okay.
Because it is only the heart rate rhythm, we cannot need to see other elements of the ECG. It can even the Apple Watch or the simple gadgets, that is electronic devices, can identify this atrial fibrillation in asymptomatic patients.
And once it's identified,
most of the time this atrial.
Sorry.
Yes.
Once it's identified, it's easy to treat as well, so the risk is less.
Yes, once we identify, even though the patient doesn't have the symptoms, we should treat to prevent the future the brain strokes. We should
absolutely treat. Thank you so much, Dr. Agrawal and Dr. Rao, for explaining all this, clarifying what our viewers asked. Thank you all so much. News will continue on the other side. Thank you all so much for watching.